Another area facing a strain on hospitals is Oklahoma City. Earlier today, I spoke with Dr. Dale Bratzler with the University of Oklahoma Health Sciences Center about the virus in America's heartland. I Googled this headline just a few minutes ago. Oklahoma City runs out of ICU beds as COVID cases spike. That's a dire headline to read, let alone to live through. Talk a little bit about what is going on in the state and in Oklahoma City.
Yeah, so I don't know that we're completely out of ICU beds in Oklahoma City. I saw that headline also, but we have had a substantial spike in hospitalizations in our state. Yesterday we had 760 patients in the hospital, which was the most that we've had since the start of the pandemic. And there has been a shortage of ICU beds, particularly in the Oklahoma City metropolitan area. The state still has ICU beds. I looked at our state health department's report, and they reported more than 100 ICU beds available in the state as of yesterday, but they're not evenly distributed across the state. And the Oklahoma City area, which has the largest population, is seeing the biggest spike in hospitalizations right now.
And why do you think that spike is happening?
It appears to be that we're seeing enhanced community spread of the virus right now. We have a patchwork of face mask ordinances across our state. Some communities have done that, some have not. We also know that in Oklahoma, the largest percentage of new cases on a daily basis are in patients between the ages of 15 and 38. High school to college age and above patients that are the kind of the engine of the pandemic right now in terms of social and mobile and getting into settings where they get exposed and get infected.
And I see that the Oklahoma City Council passed a mask requirement back in July, then recently voted to extend it all the way through December. Is the mask requirement, a mask mandate, a public health measure you support?
Absolutely. I think that we honestly should have a statewide mask mandate, because even when you look at reports that are now coming out of the Oklahoma State Department of Health, they've shown that communities that put mask ordinances into place have lower growth of new cases than those communities that do not have mask mandates. So I think we have pretty good evidence that when you support that public health measure of wearing a mask, you can slow the spread of the disease.
Do you get a sense the state is at a crisis point or a tipping point, or is this just a bad stretch? How do you characterize it?
If we see continued growth in the number of cases, what concerns me most is that if we see continued growth of COVID-19 cases at the rate that we've been seeing, or if we were to have an early outbreak of influenza, then I think we could stress our hospitals very rapidly. Part of it is that Oklahoma is a nursing shortage state. We had a shortage of nurses in our state before the pandemic started. And so just because there are beds available doesn't necessarily mean there's always staffing available to take care of all those patients.
And as a doctor, what would, in 20 seconds, be the advice you would want your fellow Oklahomans and Americans to know in this moment? What is your best bit of advice as we kind of continue down this path?
Yeah, two things. Number one, get your flu shot this year. It's just going to be critical that everybody get a flu shot so we can reduce the number of cases of influenza. And please wear a mask anytime you're around other people. Assume anybody you meet could be infected. They may be asymptomatic, but you just have to assume that anybody you encounter could be infected. Protect yourself, protect them, wear a mask.
Sound advice, Doctor. Thank you. You can count on us for the very latest developments in the fight against coronavirus. For more stories, go to newsnationnow.com or download our NewsNation Now app.